nice to meet all of you in person. I also feel blessed that Healing Beyond the Horizons has such great partners with Lakudo and also with LifeBridge International. I think that this relationship has been great and has really helped to make this endeavor successful. Honored to meet His Majesty, so I'd like to extend my personal welcome, and it's nice to meet you. So, I think as we move on, I'd have to say Dr. Kokobi is my first Cameroonian friend and colleague, and so throughout the last couple of years, he's taught me a lot about Cameroonian traditions and the rich culture of Cameroon. But I see that when Christella also tells people to talk for 1 to 2 minutes, they talk for 10. I guess that means I have 200 minutes of your time. This will be a very long presentation. So my name is Martin Palmieri. I'm chairman of the board of Healing Beyond the Horizons, and I'm a medical oncologist in Asheville, North Carolina. And for those who aren't familiar with Healing Beyond the Horizons, but I get the sense that most of you are, that our vision is nothing less than seeing the people of Cameroon living vibrant and healthier lives with access to quality health care and necessary resources that are easily accessible. And we strive to empower and partner with Cameroonians in the public and private sector to provide basic medical services, public health education, fresh and clean water, and other necessary resources that they need to live a full life. And here is our founder and CEO, Eka Kobe. So as has been discussed several times throughout the morning, there's political instability and economic hardships. You have people who are displaced, who have lost their homes, and whose families are scattered. And this is causing limited access to proper health care and services, and the health of these communities are clearly suffering. So, in light of this need, last year we put together this health fair in partnership with Lakudo and LifeBridge. And I think from our perspective, we've learned a lot over the course of the last 2 years, and it seems like this endeavor is growing and becoming more successful year over year. And again, this is a partnership between Lakudo USA, Healing Beyond the Horizons, and LifeBridge International. And so here are some pictures from the fair this last March. And so our feeling, so just to give you some additional details about what we've done, the health campaign took place in Mary Health of Africa in Fontaine and Finnegup Polyclinic in Chang, and this occurred in March of 2023. We processed approximately 1,200 patients during this event, and we identified 154 patients who had chronic diseases that needed follow-up and were eligible for our 90-day continuity clinic. The disease states that we focused on was diabetes, hypertension, arthritis, and epilepsy. But we also included post-surgical follow-up patients as well as patients with mental health. The 90-day follow-up program started in May and ended just on July 27th, so we still have some data that needs to be processed and analyzed. But we do have some preliminary data that we can share with you today. For the follow-up clinics, we had follow-up visits at the Mary Health of Africa Hospital, Finnegup Polyclinic, and forgive my pronunciation, BUA. And during the 90-day follow-up program, we focused on several initiatives. We wanted to make sure that these patients were being monitored. If we were going to provide an intervention, if we were going to be giving them medicines, we wanted to make sure that we were monitoring those appropriately. And we were trying to find ways to make that as easy as possible for the patients. And we also wanted to make sure that these patients had access to the medicines, because a lot of times traveling to a clinic to pick up your medicines was just something that wasn't feasible. So we had free medication delivery, we had bi-weekly telemonitoring, we offered free consultations, we really focused on health education, and then we also provided drug refills when they were needed. And so we identified several objectives on the outset of this project, and we're sort of just share those objectives with you. So we wanted to provide free follow-up consultations, medications, and counseling sessions to these internally displaced people. We wanted to make sure that they had access to their medications and that we were able to monitor them appropriately. We did this through a variety of means. We employed audio, video, text, telecommunications to monitor and track health concerns. We had Miss Blessings, who was a nurse on the ground who provided fantastic care for the patients and follow-up, and we engaged in home visits to evaluate the patient's response to treatment as well as to supply medications. And then we also called the patients to the hospital for one-on-one follow-up sessions where we could check their vital signs and report how they were responding from a finger-stick glucose perspective or how their blood pressure was responding as well. Our second objective was to try to overcome some of the barriers to access. With how the country is currently disrupted with the Civil War, with some of the financial concerns that folks had, getting to the healthcare providers is a challenge. And so we wanted to make sure that we could alleviate some of these access barriers, make care affordable, and make sure that the patients had access to the resources that they need. And the way that we help to do this is we have these home visitations, medication deliveries, teleconsultations, and free medications with refills. And we also, last year what we had was we only had one clinic where we were seeing the patients. And for many patients it was hard to travel to the Finnegup Polyclinic. So this year we had 3 clinics that made access a little easier to the patients so they wouldn't have to travel as far. So we added Mary Health, and Buia, okay. My parents are from Brooklyn, New York, and I was raised in the South, and I can't even pronounce most English words well either. So objective number 3 was to identify compliance issues to treatment and medications, and we found that there were several things that made compliance hard. And for the most part, it was education. And so we really focused on that. But for monitoring compliance, we would check vital signs. We reviewed their blood pressures monthly. We checked their glucose levels monthly. And then we assessed how they were responding to treatment. If they weren't responding, we made therapeutic changes in their medications if needed. And again, education seems to be the key bit here. Most people don't understand why they need to take these medicines on a daily basis. So a lot of people think, well, my blood pressure is high today, let me just take my blood pressure medicine today. But this is a chronic disease, and it's something that needs to be cared for over the long term, and not just for these brief interventions. And so we found that last year education was the #1 issue with a lot of these issues. This year it seems that education is also the #1 issue in terms of getting compliance and making sure that patients follow their care plan. And then again, objective number 4 was to identify barriers to a patient's care. And really the #1 barrier when we talked to patients, it was financial. So most patients said that due to lack of finances, unemployment, displacement, that they just could not spend money focusing on their health. They had to spend this money on other things like food and their other family needs. And so that their personal health was taking a back seat to some of their financial struggles. So I'm going to give a little breakdown of just what we did each month. So in May, we saw a total of 57 patients. We confirmed their participation in the program. And then those were the disease breakdowns of the patients who we saw during that month. So we had 23 people with hypertension, 8 people with diabetes, 5 people with both. We saw 2 people with osteoarthritis and 3 with epilepsy. We realized that that was not necessarily the enrollment that we were looking for, so we increased our communication, and what we found was that we expanded the population that we were communicating with, and we found that more and more patients, once we were able to reach out to them and make contact with them, participated in the program moving forward. So in June, we had 3 post-surgical patients, 11 epileptics, 7 diabetics, 28 hypertensives, 2 patients with osteoarthritis, and 6 patients with both. And then in July, we saw a total of 47 patients, and again, 3 with epilepsy, 10 post-surgical cases, 20 with hypertension, 8 with diabetes, and 5 were both diabetic and hypertensive. And so here are some of the baseline characteristics of our population that we saw. So the average age for the patients that we were seeing were between 50 and 60. The predominant number of patients were female, so 66% of the patients that we saw were female, 33% were male. And I think that's pretty universal that men don't take care of themselves as well as women do. Even in the United States, the breakdown would be very similar.
That's why we die early.
Yeah, that's why we die early. These are the top 10 most common diagnoses that we were able to identify when patients checked in. This was the blood pressure distribution that we identified in the patients in March. And so we see that many patients had blood pressures in excess of 140 millimeters of mercury systolic and diastolics over 100, qualifying them as being quite hypertensive and in need of treatment. So the 90-day campaign ended July 27th. We're still in the process of aggregating the data, but as more of the data trickles in and we're able to analyze it, we'll definitely share that with you. Some of the things that we found is that between the fair in March and in the 90-day follow-up, approximately 11,248 doses of medications were delivered to the health fair and subsequent follow-up program. And we identified which medications were being administered in what quantities. And I think that this information will be useful because we didn't necessarily this year want to buy all the medication up front, not knowing exactly what medications the patients were going to need. But when looking at 2002 data and comparing it with 2022 data with 2023, we found that we used mostly the same medications. And so knowing approximately what number of doses that we need to supply, I think moving forward we could make a large purchase all up front rather than having to make purchases intermittently throughout the program, because and that was a source of delay in getting some of the patients' medications was the reordering process and having them shipped to Cameroon. Here are some of the preliminary blood pressure data that we had. And if we see their patients' blood pressures in May, their blood pressures were elevated in the 130 to 160 range in May. But as we go month over month with patients taking their medications and having consistent follow-up, we see a trend in the blood pressure going down. I don't know if there's a pointer on this one. Yeah, which button do I press? Yeah. Okay.
Not too much.
So what do I press to go back?
So what is this?
So yeah, we see a nice trend down in people's systolic blood pressure, a nice trend down in their diastolic blood pressure as well. So, you know, what this basically shows me is that the intervention that we're taking, having patients be compliant with their medications, that we're getting the desired effect. And so I think we're going to be taking this information to the next step, saying that if we can develop a program like this and sustain it over the course of a year, we could definitely have a large impact on the local population's health. And I think in order for Healing Beyond the Horizons to be able to provide the support that we need to continue this program throughout the year, we're going to need to start to apply for grants to get that support. And having data like this showing that our intervention is working, our intervention is having an impact on these communities, I think will sort of help us in that process to get those grants that we need. As we went through the process, we consistently analyzed where we were, where there was areas for improvement, where we can make things better. Communication is always an issue. Many patients don't necessarily have access to a telephone. Many patients don't have an address that we can communicate with them at. A lot of times they would have someone in their village where that we could communicate with that person in the village, and that person in the village would then go out and find the patient for us. And so trying to reach out to some of these people in the 90-day program follow-up was an area where we did lose a lot of those 154 patients because we couldn't reach them for follow-up. Again, patients were inaccessible. Some of them lived in crisis areas where it just wasn't safe for them to travel or for us to travel to them. And then there were some also issues with, like I said, ordering some of the medications. We ordered the medications in bulk. So we had two big orders of the medication, one at the beginning and then one in the middle. But a lot of times when we had to order that second round of medications, it wasn't an easy process. And a lot of times that resulted in some delays in getting medications to the patients. And so my hope is now that we know approximately how much medicines we need to order for the full health fair and 90-day follow-up, that we'll be able to order everything all at once. Now we did note that even though there were some problems still that we need to work out, there were things that are getting better. We found that by providing education in 2022, that some of the patients who returned remembered some of the things that we shared. We also found that we were a little more diligent in how we educated patients, making extra time to make sure that they understood how to take their medications and the importance of taking their medications. And our feeling is that as we do this year over year, people's general health knowledge is going to improve, and that this won't be as much of a challenge as we continue this program moving forward. Documentation is always an issue. Many of us have terrible handwriting as doctors, and so there was issues with consistency of documentation, legibility of documentation. We did have, it was better than it was in 2022, but it still posed challenges as we were trying to interpret what people were writing on these passports of health information. So one of the things that we're looking to do next year is develop a spreadsheet and then have this spreadsheet where people can enter the information electronically so that there won't be any of these legibility issues. But in order to do that successfully, we're going to have to train people on how to use these spreadsheets and make sure that we have the right people who have the savviness to enter information in that manner there. So we're going to be working with volunteers and bringing some of our own volunteers to Cameroon next year who have this experience and are going to be able to do this. So, we think we need some standard operating procedures. We had triage nurses that were working at the fair, and a lot of times for some of these triage nurses, they all did things a little differently. And so we need to sort of operationalize how that is done. We think that that would make things more efficient during the fair moving forward. We need better tools for data collecting, which in part is going back to building those spreadsheets and training volunteers. There were some bottlenecks that took place in the lab, and so the general feeling was that we should have more lab technicians, and that may help prevent that. And again, making sure that we can get the medicines to the patients when they need them without any delays is going to be key to our plans for next year. And so there's lots of people that I would like to thank for this. We had some wonderful volunteers there on the ground in Cameroon, and I think this couldn't be done without everyone's participation. So I would like to thank our folks in Cameroon, as well as everyone here with Lakuta who helped work with us. So thank you.
This is again another area of community service. The only challenge.
Gaza Media, this is Dr. Fonkem and Dr. Pemere. If may just